So, hello friends, we have started this series on studying epidemiological studies and what we can calculate from those. So, our topic is case control study. So, what we calculate from it and what it is, let's go through it. So, a case control study starts with outcome, disease, and look back for exposure. So, disease has already occurred, and we are seeing the looking back for identifying the exposure. So, main measures that you can calculate from here is odds ratio. Most important measure in case control study is odds ratio. It tells how much higher or lower the odds of exposure among case is compared to control. So we can identify how much times higher the odds is on exposure. It is used as a measure of association between exposure and disease. So when association formation is the matter, we'll use case control study. So here you can see a 2 by 2 table. Um, and you can see exposed and non-exposed on in rows and case and control on columns, and you can see ABCD as mentioned in this table. Okay, so what is odds ratio and what is its formula? Odds ratio is odds of exposure among cases. So what is exposure among cases odds? A upon C, which is exposed cases upon non-exposed cases divided by exposed control upon non-exposed control. So, in short, we can say that we cross multiply A and D and C and B. So, this is odds ratio. I hope you got it. A into D upon B into C. So this is odds ratio. Interpretation of odds ratio. If odds ratio is 1, there is no association. If odds ratio is more than 1, exposure associated with higher odds of disease. And if odds ratio is less than 1, then exposure associated with lower odds of disease, which means that the exposure is protective for the disease. Now, important points. Odds ratio is used because we cannot calculate risk directly. Incidence is not known. Yes. In case control, we are not able to calculate incidence, so we are not able to calculate the risk directly. So we are using odds ratio in this. In rare diseases, less than or equal to 10% or approximates risk ratios. Okay. Odds ratio cannot be used to calculate incidence or risk. Cannot be used to calculate incidence risk. Okay. Now let's understand this with an example. So here we are taking 100 lung cancer patients and 100 non-cancerous patients which are controlled, and exposure is smoking. So we made this 2 by 2 table and calculated the odds ratio. So as per this values, the odds ratio is 3 by 5. What does this signify? The odds of having been exposed to smoking are 3.5 times higher among the lung cancer patients than among patients without the lung cancer, which are controlled. So 3.5 times higher odds of getting lung cancer when you are smoking. Other measures we can use in case control are attributable fraction among exposed. So in this what is the formula? Odds ratio minus 1 upon odds ratio into 100. Proportion of the disease among exposed attributable to the exposure. Yes, sorry. And preventable fraction, which is 1 minus odds ratio into 100. Proportion of disease prevented by protective exposure. Okay, so these were the three measures, and amongst this, odds ratio was the most important one. Takeaway, sorry, in case control study, the main measure you can calculate is odds ratio, which shows the strength of association between the exposure and disease. Yeah, cannot calculate risk incidence or risk ratio directly in case control study. For that, we need to do cohort study. In case control study, we find the odds association by odds ratio. Thank you.